something like half of all PCI is now done transradially in the UK. So I decided I needed to talk to Dr. Karim Ratib, University Hospital of North Staffordshire in the UK. And we're talking about the neurologic complications following intervention, transfemoral versus transradial. Now, this is looking at the access in 300,000 procedures. That's a lot of procedures. Yeah. Why did you set out to do this study in the first place?
Well, in the United Kingdom, as you already said, about 57% in 2011 were performed transradially. And there's been a big shift from 2006, where less than 20% of procedures were transradially, to where we are in the present day. And we wanted to look to see if this change had any impact on other outcomes. And especially when people are early on in the learning curve, they're going to have longer procedures, more catheter manipulation, more catheter exchanges, and all these are predictors of neurovascular complications.
Well, when they were first being studied and the FDA was reviewing the material, one of the first things they looked at was there was a slight uptick in neurological complications right on, and I thought the FDA was going to have a stroke. What did you find in your study?
Well, the bottom line is in 388,000 patients, 147,000 of which were performed radially, the stroke rate was exactly the same, with no significant difference in either group. 0.1% was the rate of stroke in both groups. So
is it 30-day, year? What's the numbers?
These were all peri-procedural strokes.
Okay, so no difference even on the short term on something.
Yeah, these are the short term. The strokes were all recorded on the PCI database, and so they're usually strokes that occurred at the time of procedure or shortly after, before discharge.
I mean, what was it? Because I saw the slides myself where it looked at the very beginning like there was that. Is it a factor of once you get to doing these, those numbers disappear, or what caused that bump early on that made it appear like there were going to be problems?
That was I think in the SCAR data. They showed they had an increase in stroke initially in the radial group, or neurological complication in the radial group. It's not clear what that was down to. Well, it was a very large difference in the SCAR data early on, and it can't all be accounted for by the learning curve because it was such a large difference. But in the UK data, where we've had a big shift over the last 5 years, there was no significant difference year on year in the stroke rates, and this was with lots of operators early on in their learning curve when they're switching to doing more radial procedures.
I mean, obviously there's more transradial procedures being done, and given that, has there been any change in how things are done to reduce whatever chance of neurological complication there might be? Have you gotten better?
I think with practice, yeah, people will use less catheters and their procedure times will be lower. And so with doing more radial procedures, people will get better at it. It will take less time to do the procedures. But it's reassuring from our data that even though people are switching from one access site to the other, there was no obvious signal in neurovascular complications.
So the arguments against moving from transfemoral to transradial, they seem to be disappearing. Yeah. very greatly.
And the benefits from going transradially, we've seen in meta-analysis of STEMI patients that there's a significant mortality benefit at 30 days in randomized trials, and so there's more reasons to go transradially. And from the arrival data, with significantly less access site complications in the radial group, there's like I say, there's more reasons to go radial than femoral at the moment.
And it's really good that out of almost 400,000 people in the study that there really are no differences in the neurological complications. Some more good news for transradial access. For CardioSource World News, I'm Rick McGuire.